Good afternoon, everyone. Thank you for joining us. I think we'll give folks one more minute. I know this is a busy time, busy afternoon. Um, so want to make sure as many folks can hear the whole presentation. Okay, Rebecca, if you want to start sharing slides, I think we can get started. Good afternoon. Welcome to our May, I had to remember what month it is, Data and Action webinar, CHEI behind the scenes. So we will have everyone introduce themselves in the chat. If you could say your name and pronouns if you'd like, and what organization you're joining us from, that would be great. We're going to start with a Community Health Equity Initiative, or CHEI, overview. We have three speakers here today. Ben Wood from Health Resources in Action, or HRIA, Emma Posner from Tufts Interdisciplinary Evaluation Research, or TIER, and myself, McCain Scharf, from the Department of Public Health with the CHEI team. After each of our speakers go, we'll have time for question and answers. And then we will wrap up and talk about next steps. And as a reminder, slides and recordings will be shared after the meeting. If you're just joining us, if you could put your name, pronouns if you'd like, and the organization you're with in the slides so we know where you're joining us from. All right, just want to do a quick welcome to the CHEI team. We have folks from DPH in the Community Health Equity Initiative. We have folks here from the Metropolitan Area Planning Council. I can't see both who's here and talk at the same time, but if you want to say hello, and they'll be putting in the welcome where they're from. Tanaya is here, and I don't know if Barry's here from MAPC. I saw at least Caroline from my team. If others are here, feel free to just introduce yourselves in the chat. And then we have Rebecca and Lisa from the Public Health Institute of Western Massachusetts. All right. Are we supposed to be doing a Menti? Thank
We
you.
are. There it is. I was like, we're skipping ahead. Um, so we would love to know, in the spirit of the hot summer weather that we're suddenly having in the middle of May, what one food or drink that your community does best during the summer is. And if you're new here, oh, looks like people are already doing it. You can either scan that QR code on Menti, or you can click the link that I just threw in the chat to answer our little question. There we go. Oh, yep. Iced coffee, popsicles, barley tea. Where are people getting rose flavored milkshakes? Do tell more. Oh, my apologies. Lobster rolls, frozen lemonade, popsicles. Love it. We'll give it another maybe 10 seconds for folks to entice us with some sweet treats. Man. Oh, I love it. I love all of these wonderful, delicious foods and drinks. Thank you all so much for sharing. Just gonna
Rebecca,
pop
do you
this
want to
over.
quickly introduce yourself since you're
Yes, yeah,
spotlighted?
since I just popped in. Yes, I'm Rebecca Hunt from the Public Health Institute of Western Mass, and we are on the Regional Data and Action team. So if you put in a data request, you might meet me.
Thanks, Rebecca. And thank you all for sharing those delicious, cool, sweet, savory treats. I am now hungry. I still have dreams of us all getting together and sharing these treats together, but one can dream. So for anyone who is new to CHEI or needs a refresher, we'll just start with a quick intro about what the Community Health Equity Initiative is. We are a health equity data system. We were once funded by a grant from the CDC. During COVID, the Department of Public Health received funding to try to understand some of the social determinants and upstream drivers of health that were impacting Massachusetts residents during the pandemic. So the first survey and data collection happened in 2020 as the COVID Community Impact Survey, or CCIS. That funding ended, and the Department of Public Health has made a commitment to continuing on our work. In 2023, we did another data collection round, and we're getting ready to do another. You'll hear more about that. So we are currently funded by the Department of Public Health to understand and act on lived experiences of residents. So we focus on root causes of health, including the social, economic, and environmental conditions that lead to inequitable health outcomes. We collected data in numbers through the Community Health Equity Survey and data in words through our resident-led interviews and focus groups. And we'll talk more about both of these today. We have 3 pillars, one of which is our health equity data system. Another way of which is community engagement. So we are focused on centering the voices of communities that experience inequities in Massachusetts in the development of our survey and materials, in the outreach that we do to inform our data collection practices and ensure that we get as many responses as possible. And in the analyses that we do, we provide data broken down by populations, which we call our communities of focus, as well as geography. And we are very intentional about the ways that we analyze data to bring numbers to the inequities we see and voices through our qualitative work. Next slide. The third pillar is data and action. So we are a health equity data system for action. So all of our practices are informed by the desire to move data to action and to inform and enhance action that's already happening. So that's both for DPH and state governments to use to inform resource allocation, services provided, and programming through sharing data back through publicly available data sets and dashboards, which are available on our website. If one of our team members could put the link, that would be great. We also provide customized data analyses to community partners to use And they have and continue to use that for grant applications, advocacy reports, and to inform programming and community outreach. On the screen here are a couple of examples. I'll talk about how you can learn about more later. Thank you, Tanaya. So here's 4 examples. The Massachusetts Attorney General's Office has used data to inform resource allocation around paid leave in Massachusetts. The Spanish American Center has used CHEI data to inform funding applications. The Neshoba Associated Boards of Health have used CHEI data for regional advocacy. And Accentria Care Alliance has used the data for programming as well. We share these stories on our website, more to come, as well as through our listserv. Again, we'll let you know how to get both of those things shortly. And then we also offer collaborative learning cohorts and webinars such as this one. And this is a fun fact here that we know of over $100,000 that have been successfully awarded to folks who have used data in grant applications. That's what we know about. We always want to know if you're using our data and how you're using our data. So please let us know. Next slide. We offer data and action support through our regional data and action providers, and they provide free tailored guidance on using CHES data to support action. They might recommend resources and capacity building opportunities, and they conduct customized data analyses. We're so grateful to our partners. So this is MAPC and PHI of Western Mass. And this graphic here is one of the resources that they provide, which is a data and action toolkit available on our website. I think I'll leave it there so we can jump into our presenters. Next slide. And then before we do that, I have to do a plug for our 2026 cycle, data cycle, we're now calling it. We have begun. We are in our 2026 data cycle, and we'll tell you more about what that looks like. You will be hearing a lot more. And if you are not already on our listserv, please sign up. Rebecca Hunt put the link in the chat, and it's the best way to stay connected. Next slide. All right, I am going to pass it off to our first speaker to tell us more about what the Health Resources in Action, or HRIA team has been up to for the 2026 data cycle. Take it away, Ben.
Thanks, McCain. Hey, everybody. Super excited to be here. And yes, you should get pumped. You should get pumped because it's coming. The next round of the survey is about to be here. It'll be released sometime in July. Not entirely sure exactly the date yet. But just to forecast a little bit that we have, the next month and a half to really get all of our ducks in a row. And make sure that you all and the folks you work with and folks like you who care about public health in Massachusetts, who care about making sure that there's good, actionable information to address the sorts of things that you are working on, that your communities are in need of having support solving for, all the things that McCain was talking about that CHEI as an entire initiative does really well. Ben Wood with Health Resources in Action, HRIA, here representing the HRIA CHEI team, CHEI team. It's a large team of folks who are doing a bunch of different things behind the scenes, and not just behind the scenes, out and about, talking to people. That's really where sort of we're at this point in time, and wanting to do a lot more of. And just on a personal note, I've been part of this initiative since I was a staff member at DPH, helping design and roll out the first iteration of this when it was the COVID Community Impact Survey in 2020. Heavily involved in the 2023 version as well. And I just can't say enough about how this whole thing has grown and what DPH and the partners have done to create this survey as a larger holistic initiative that has legs and momentum and movement all throughout the time period, and not just about survey data collection, but really about doing something important with it. Just a few little updates here. What we are doing at HRIA and some of the things we've been focusing on over the past couple months, and continue to be doing some more of. You can sort of consider HRIA to be like the core community engagement team member for CHEI. We are doing a whole bunch of different things. And so what's on this slide really isn't totally encapsulating it, but these are just some big buckets of information so you have a little bit of a sense of some of the major ways that activities are being structured and organized. So one of the major ways, and really I think the foundational piece and the most important piece, is the Community Engagement Advisory Committee that has been established. It is a large group of folks, 30 plus organizations and people representing organizations and communities across our great state, from diverse population perspectives, from issue areas, the things that they care deeply about. And they are folks who participated in 2023 with us, and some new folks who we've brought on just this year as well, in a spirit of like continually trying to learn and engage and talk with new and different people. So it's this great group of folks who really help us structure and think about what it is that we're trying to accomplish from a community engagement perspective. We lean on them, we talk to them, we take all of their input and we try to put it back into practice in terms of how we're using our own internal resources, how DPH uses its resources, how DPH is structuring the survey itself, all those good sorts of things. Also, this year we are focusing really strongly in on understanding the particular harms that are present in immigrant communities in Massachusetts and in LGBTQI A plus communities in Massachusetts because of all of the heightened risk that those communities face. And we've been having lots of intentional conversations with organizations who serve those populations to really get a deeper understanding of what does it look like to participate in a government-funded survey in a time of heightened threats and heightened harm. So that's been a really important area that we've been digging into more. Been really focusing in on refining our communications toolkit that we developed in 2023, using that as a platform and doing some adjustments to it, refining it. Working with our Community Engagement Advisory Committee to ensure that the imagery and the language is really representative of the types of communities that they want to be engaged and engaging with, to encourage folks to participate in the survey. So those toolkits are going to be available to everybody, and we'll make it easy for people to access them. They're going to be tools and resources that can be readily printed out, downloaded, and also customizable so that you can take some of the templates and put your own logo on it, your own images, things that you want to really make sure are really sort of focused in on the populations and communities that you work most closely with and are part of. We've been doing a tremendous amount of like what we're calling strategic conversations, just a lot of one-on-one conversations with folks, state departments, community-based organizations of all kinds, statewide coalitions, others, to really have a good sense of an understanding of what it is that organizations are needing from a survey like this one in the here and now, the types of barriers that that they know that communities are facing, and the challenges of encouraging people to participate in this type of data collection effort, and opportunities for meeting folks where they're at and really helping help us create sort of the communication approach and the relational approach to ensure that we have partners who are lined up to be champions as the survey gets into the field. And then lining ourselves up for actually getting out and being in community as when the survey is launched, so that there will be members of the HRIA team out and about, and that's something that we can coordinate with you all too. Like if there's an event that you know you're going to be at, some sort of a gathering of folks, and you could use some additional staffing time or support to have somebody there to help hype up the survey and talk about it. Those are the sorts of things that we want to be knowing more about. We'll be sort of doing our own landscape analysis and understanding of where there's really high opportunity places for us to be. But it's something that we want to be digging into and talking about more with all of you. And then down here at the bottom, it says mini grants. And it's a really important piece of what we do. The 2023 survey was successful in large part, I think, because we had some money to provide small dollar grants to lots of different organizations in a very low burden and very unrestricted way, so that those organizations could have a little bit of flexible funding, discretionary dollars, to do what they thought was best in terms of getting the word out about the survey, compensating some of their staff time, printing materials, doing cash incentives for people to participate in the survey, buying food for events to make them actually comfortable spaces for people to actually want to be and come. All those sorts of things are the creative tools and approaches that folks like all of you know how to do, and we're going to be doing a mini grant process again this year. I think that's it for this slide. Next slide. All right, so there was some questions that came out in the registration for this webinar. One was, how can our organization be a partner or add value, and how can we contribute to data collection and dissemination? And really the answer is in so many ways, right? But one major take home for me participating in all this work for again, like this is my third time going around the sun with this work and this survey. It's all about activating your networks, right? It's all about you being a champion to support the people who you know, the populations who you work with, the communities that you're part of, to say why it is that you are interested in this survey, and then encouraging folks to participate in it. It's all about those trusted relationships. And I also say, I just put a little plug in right here to use your personal networks too. Sometimes I forget that myself. Like we're like big push on engaging with community organizations and others who are serving folks who are not necessarily within my personal networks, and I forget that I want my friends to take the survey. I want my spouse to take the survey. I want my kid to take the survey, right? Like activate your personal and professional networks as much as you can. But you utilize the communications toolkit. It's going to be available. It's going to be robust. We hope you like it. Use it, use it, use it. If there are additional strategic conversations you think we should be having, reach out to us, CHEI@mass.gov, and we will coordinate with DPH, and we'll make sure that those conversations happen. And then attending as many different types of events as you can. And as I said before, let us know if there are spaces in which you want us to be at as well, and we can do some coordination. And the final thing I'm going to share as well as an idea and opportunity, it's not on the slides, I'm going to drop it in the chat, is the Root Cause Solutions Exchange. The Root Cause Solutions Exchange is a really great DPH initiative, very aligned with what CHEI is all about. It really helps folks connect up who are doing and trying to advance the hard work of root cause activities across the state. We are going to be leveraging the Root Cause Solutions Exchange's online platform of folks to share a lot of information about CHEI and the survey as it's out in the field over the summer and the early fall. It'll be a place to go to hear sort of success stories about what is working in terms of outreach and dissemination. We'll also be able to post some resources there as well. So if you're not a member of the Root Cause Solutions Exchange, hit that link, sign up. And it'll be a place where you can have some ongoing engagement with outreach with the survey. And I probably took way too much time. I'm sorry, folks. I'm done with my slides.
Hi, everyone.
You muted yourself, Emma.
Oh,
I
sorry
clicked a
about
link
that.
or something.
Nope, I wasn't sure if I was supposed to jump right in. Hi, everyone. My name is Emma Posner, and I will be providing updates on the Community Health Equity Qualitative Projects, which we will refer to as CHEQ. And we can jump to the next slide. CHEQ, which is the qualitative arm of CHEI, will be led by our team at Tufts Interdisciplinary Evaluation Research, or TIER. We are a small evaluation research center at Tufts University. Our team includes a range of expertise, including both experience in research and qualitative methods, as well as personal and lived experiences connected to our projects. The data for CHEQ will be collected and analyzed in collaboration with community evaluators, who are residents from across the state and members of our research team, who will bring their lived experience within the different communities and topics we'll be focusing on to their qualitative data collection. As you heard earlier in this webinar, CHEQ collects data through words and aims to understand experiences that can be difficult to assess through surveys. We hope to complement survey data by unpacking some of these experiences through words. For example, surveys can tell us about what types of challenges residents may be facing and to what extent or how often they're facing these challenges. But qualitative data can tell us a bit more about how these challenges show up in people's daily lives and can help us dive a bit deeper into how these experiences are affecting particular communities. Currently, we are engaging state and local partners to identify communities and topics to focus on for CHEQ. And given CHEI's focus on using data for action, we're working to make sure that the data we collect will help inform state and local partners' day-to-day work, such as program planning, policy development, and program practices. Next slide, please. So now I'll provide some brief updates on our work. Our work will be carried out in 3 project phases. First is our planning phase, which is happening now. Second, data collection and analysis, which will begin late summer and early fall of 2026 and last about a year. And lastly, dissemination, which will begin in fall of 2027. During our current planning phase, we're actively working to gather feedback from both state and community partners on the topics and communities that we'll prioritize for CHEQ. Our ongoing planning activities include reviewing feedback from engagement meetings that CHEI partners have held to date, both at the state and local levels, planning meetings with state and community partners to dive deeper into the qualitative data needs they may have and to explore how qualitative data can inform their work. And I'll share more about an upcoming opportunity in a minute. And we're also planning to recruit a team of community evaluators who, as I briefly mentioned, will bring their lived experiences and relationships with the topics and communities to qualitative data collection. And they'll receive mentorship to carry out the qualitative data collection and analysis process. We have a couple of community evaluators on board now who are working with us on this planning phase, and we'll be onboarding a cohort of additional community evaluators this summer based on the communities and topics identified for qualitative data collection. Next slide, please. So what will CHEQ involve? We are planning 15 to 20 focus groups, or this could include another qualitative method or a combination of qualitative methods like focus groups and interviews with communities that state or DPH and community partners identify as important to hear from. We'll be exploring 2 broad focus areas, which we'll refer to as thematic focus areas. And we're currently working to refine these broad focus areas together with DPH and community partners. They are, the first is perceptions of public services, which includes how access, barriers, cultural norms, personal experiences shape people's views and behaviors related to health information and service seeking and decision making. And the second is community strengths and cohesion, which would include what may contribute to feelings of connectedness and senses of belonging, how people identify their community, and what helps communities respond to health-related challenges. Our hope is that these two broad topics will be relevant to a wide range of partners at the state and local level. And when exploring these broad topics, we'll be working to make sure we focus on some common questions that may be relevant across many different communities. And we're also working to build in the flexibility to explore questions related to these broad topics that may be unique to particular groups. This could include, for example, questions that may be particularly relevant for young people, or for people who are immigrants, or for parents of children and youth with special health needs, just to give a few examples. Last slide, please. So I've talked a bit about how both our topics and communities are still in development and how we're working to make sure they're as useful as possible to state and community partners who are looking to use qualitative data to inform action. So if these topics are of interest to you, or if you're even just interested in learning more, we're hosting a planning webinar on Wednesday, June 24th at 2 p.m., where we will explore whether and how you see using the CHEI qualitative data to inform your work. And we'll discuss communities that you think would be important to engage through qualitative data collection. Given CHEI's commitment to collecting actionable data for both state and community partners, we will prioritize the data needs of partners who have identified a plan for and a commitment to using their qualitative data. So we hope to see some of you at our planning webinar, and we're happy to answer any questions you may have in the meantime as we work to make sure that CHEQ meets as many different partners' needs as possible. And we put our planning webinar registration link in the chat, and my email address is on the slide in case anyone has any questions.
Thank you so much, Ben and Emma. One of the great things about having such a large team is that we have other folks who are doing the work and talking about CHEI and sharing the burden too. And I'm so grateful to be part of the larger CHEI team. And I know you all want to know what DPH has been up to and what, oh, sorry, and my son just came home from the bus. Dad is intervening. Apologies. Okay, so I am an epidemiologist with the CHEI team, and I am sharing what we've been up to. So in addition to our amazing partners, we have a really great team at DPH, and I'm going to share some of what we've been doing, including what we call over here vendor management. But it's really just bringing on folks who can support us. So our vendors are HRA, MAPC, PHI, TIER, basically alphabet soup. And we're very lucky this time around in 2026 to have all of them on board for the full 3 years. And like Ben said, I mean, he predates my time with CHEI when it was CCIS still. There's some great learning and growing that we're doing together because we have the same partners that we did for our last data cycle. So we're even getting together in person as a full team, and I've been thrilled by some of the relationships between our vendors that have been happening without us. It really is a joy to work on this team. What we've been doing over at DPH is a lot of getting ready for the 2026 Community Health Equity Survey. So I'll talk through that. But before we started that, we were doing a lot of data analysis of our 2023 data. So I'm going to talk about all of that and sort of pull back the curtain a little bit about what we've been up to. And I have a very short amount of time to do that, but I will share ways that we are going to continue to share what we've been up to. Next slide. Okay, so here is our timeline for the survey. So the survey is one part of the work we will be doing, but right now it's the focus because we're getting ready to have it out in the field in the summer of 2026. And so that means a lot of work has gone into having it ready to be able to send a link off to everyone you know. So we're in our development phase that started back in the winter of 2025 and has continued into this morning. I had several calls this morning about language and REDCap. So it's still ongoing, and I'll share a little bit more about what we've been doing. Next slide. So for those of you who were with us in the 2023 data cycle and engaged in the 2023 process, a lot of the things are staying the same. For 2023, we had over 100 partners provide over 1,000 pieces of information and data to inform our CHEI 2023 data collection. CHEI and CHES 2026 will look mostly the same, but we've learned a few things. So I'll talk about that. Our communities of focus and most of our topics and questions will stay the same. And then we will still have, as Emma shared, qualitative data collection that's focused on topics and communities where a quantitative survey is less appropriate. So what's changing from 2023? Some people had strong feelings about some of our questions and we listened. So those questions have changed and are hopefully better. We've been reflecting as a team about how our goal is always to improve. And that means that we're not a great survey to use to look at changes over time because we're less concerned about the question remaining the same and more concerned about the question being the right question to collect the data that we want, our partners want, and that is actionable. We are always aiming to shorten the survey because we heard a lot of folks say it should be shorter. Caroline is here and is keeping us honest, and it won't be any longer, but I can't guarantee it will be any shorter. But that means that some questions that were on 2023 will go away, some questions, so that we can add questions related to emerging priorities and to our theme of centering strength and resilience. This is a hard time to be in public health. It's a hard time to be in the world. And we want to make sure that we're being responsive to the needs of our communities. So we've added some topic areas and some questions that reflect that. Our COVID-19 section is now a vaccine section. We've added questions to collect the experience of immigrant communities. We've added a gun violence question. So we are trying to be responsive to what's happening now and to ensure that the questions we include are actionable ones. So I'll talk more about how we figure that out next. Okay, so how did we make sure that we have a better survey in 2026? We reviewed the 2023 survey. What data did we get that was really hard to analyze or didn't give us the kind of data we were expecting? What feedback did we get from partners about, like, some people really hated some questions. Some people felt that the question could be a little better to get the data they need. So we have been getting that feedback since the 2023 survey went out. We've collected that information and we've reviewed it in anticipation of 2026. And then we also reviewed how our partners use the data. So if we had a question on 2023 and not a lot of people used it, then it either wasn't the right question or it wasn't a question that makes sense to keep for 2026. Because we're now funded by DPH and because we have heard from our community that there is a desire to have change within DPH informed by CHEI data collection, we started with our internal partners. So we had 4 listening sessions as well as a form to sort of get generally information about what people are on people's minds, what topics to add, what resources and support they needed to use the data. And we reviewed everything, you know, we collected that, we reviewed everything put in a form to inform 2026. We also had at least 46. I went through and looked at our notes and we had 46 meetings with notes. So at least 46 individual meetings with EPI and program staff at DPH. And at all those meetings, we asked, what are your data needs? How can CHEI data add to what you already have? And how will you use that data if we collect it again in 2026? Or if you're asking for a new question, how will you use that new data? And then anybody that was wanting to be engaged and use our data in 2026, we asked to fill out a data and action form to really lay out their plans and commitments to using that data. So a lot of work was happening at DPH. And then we built a survey and it is so close to being done. It is with our commissioner now for the final review. And you would be like, you might say like, why don't you release the survey tomorrow if it's done? Once the language is finalized, it goes into our online data system and it goes off to translators. And so we have to get all the language, new language or modified language translated. That will come back to us. We have some wonderful partners who work with these communities that speak these languages that will review the translations to make sure we're getting them right. And then those translations will go into our online data collection system, REDCap. And then we can release the survey out into the world. And in the meantime, there's a lot of great work happening that our partners have shared some of what's going on. HRA is working on community engagement. TIER is working on the qualitative work. The RDA providers have been continuing to do the data and action work. And what we're doing, what we will be doing once the survey is finalized and out the door, is really focusing on our sampling goals and how areas where we can improve. So last time we had goals. You're welcome, and thank you for acknowledging it. So if we didn't meet our goals in 2023, we know we need to do something differently. And so that is informing our mini grantee list, our planned engagement strategies, the communities that we're talking to, that for those one-on-one meetings that Ben was referring to. And if there was a time when we couldn't do the analyses that we wanted to, then that will also inform our sampling goals. I've been so heartened and our team has been so heartened by the enthusiasm. I think we went into the 2026 cycle worried about the community's willingness to answer a survey from the government right now. And every time I interact with our community partners, it fills me back up. It reminds me why I spend so much time talking about one word on the survey and if it's the right word. And so we're excited, we're hopeful. And the more responses we get, the more we're able to do with our data. So we hope that you'll continue to partner with us throughout the 2026 cycle. Getting a little emotional here. Okay, so next slide, please. So Ben talked about this a little bit, But one of HRA's big roles is to help facilitate the Community Engagement Advisory Council. And many of those folks were with us in 2023 and they're back with us. And it's so fun to see familiar faces and hear familiar voices. So once we had a first draft of the survey, we sent it to our CAC. They reviewed all of the text, made sure we were capturing the right topics, meeting the current needs and the current climate, that the question wording was right and not harmful, that we had the right response options. We wanted to make sure that that the questions were appropriate, accessible, and not causing harm to the folks that they work with so closely, because they are closest to their communities. So they also filled out a form. We got all that data back. We reviewed it all, and we have a new draft, and that's the one that's being reviewed right now. The CAC is also really helpful in reviewing communication materials and co-creating outreach strategies. Again, they know their communities best. And then they will be the core of the folks sharing the survey, but we will recruit everyone and to share it. And I think I just want to repeat what I said, but we're so grateful for the ongoing and deep partnerships with the CAC and the broader CHEI partner network. When I'm having a bad day and I go to a CAC meeting, I remember why I do this work. So we couldn't do it without our partners, and we do truly feel like it is a partnership, and we are thankful. Next slide. All right, so I did talk about all of that 2023 data and what we've been doing. So our community partners have used CHEI data in so many amazing ways. We've had 135 data requests that have gone to the RDA team, and Rebecca or Tanaya have answered those. So maybe you've seen their faces, been in meetings, received data, and then done something with it. Oh, I was supposed to put a link. Can someone from my team put a link to the impact page, please? Isabella's not here because she graduated with her MPH over the weekend, and she's off on a trip celebrating. But she developed this great impact page to share the stories. And then Tanaya's getting some great shout outs in the chat. We love Tanaya too. And so if you want to look, Caroline just put in the chat our impact page. And then in our listserv, Isabella includes sort of a quick story of how folks have been using our data. And we hope that inspires others to use our data as well. DPH partners are also using CHEI data as well as our practices. So we've had 44 internal data requests that our team has met and provided data that's not available otherwise on our dashboard or in our data tables. And that's informed programming, it's informed RFRs, it's informed decision-making that's happening and planning that's happening in DPH programs. We've also done a lot of practice sharing. And this is an area where I think we can share more soon. So we have a new CHEI framework for change. We've really been thinking about how do we ensure that the work that we're doing is actually moving the needle on health equity. And then we revamped or created commitments around community engagement, around data analysis, and there's one more, I can't remember, data and action. And then we've been sharing those, right? We don't want to just do this. We think we're doing community informed, community engaged data collection that's rooted in health equity values, and we want to share our practices with others. So we share wherever we can, and people are willing to hear us. And it's been working. We're gaining and sustaining leadership support at DPH. We have some great DPH champions, and in re-engaging with some of our DPH partners to inform 2026, we learned other ways that we didn't even know about that folks were using it. We learned about ways that folks have changed their practices based on what they're learning from us. So it's great. It's great to see. DPH moves at a slower pace than you all, but it's happening. And then in the midst of our survey development on a random day in April, we learned that all 16 of our CHEI 2023 Spotlight reports were approved for publication. So what we'd mostly been doing between the survey closing in 2023 and now is data analysis and developing reports. So those were topic-based reports that we developed, qualitative reports from TIER, and mixed methods reports from TIER with support from the RDA team. And so we will share the first of those reports at our June webinar. And we'll continue to share as much as possible in the months to come. We have to work on some accessibility pieces before we can post those reports, but as soon as we can, we will get them out to you all and hope that they're helpful in informing your work. And we can always do better. So we also want to know if there are ways that the reports are not meeting your needs, because we'll do it all again in 2026. Okay, I've been talking a lot. I have one more slide and then we'll move into our Q&A, and I haven't left enough time and I apologize. Okay, so these were 2 questions and I'm just gonna say we're working on these. I don't have a full answer yet, but these are questions on our mind as well. So how can we help Massachusetts leaders address and not just name clear inequities in healthcare, legal outcomes, or other outcomes, and hold people accountable? We're working on it. How are we measuring health equity work, particularly in the context of broader policy, systems, and environmental change? So we're thinking about all these things. As soon as we have some sort of answer, we will share, and we'll continue to learn from you all. So we have a little bit of time for questions. I'm going to pass it to Lisa with my apologies that I did not leave more time for you.
Hi, good afternoon, everyone. And no apologies needed at all, because the whole point of this session was to look behind the scenes. And I think our panel has done a great job of that. We did get great questions during the registration process, which the panelists have tried to address for us to the extent that they could during their presentations. So I think we would love for you to add your questions here, and perhaps we can do some follow-up by email out when we send out the slides and the recording. So for now, I think we'll just leave it with this round robin question of what's one lesson, I'll leave it for one for each of the panelists, what's one lesson that you think has been most important that you have carried forward or that you plan to carry forward in 2026 based on the first 2 rounds? McCain, you've been doing a lot of talking, so let's see if somebody else would like to answer. Emma, do you want to tackle that question?
Sure. So there are 2 lessons from the last CHEI cycle that we have been working to build into our planning process. The first is the structure for the qualitative data collection. So we previously centered or focused on qualitative data collection within specific communities. And so we focused on the experiences of 6 specific distinct communities across the state, and not just geographic communities, but also thinking about people's identities and experiences. So for example, one of our communities was older adults living in Boston. For this cycle, we are structuring the project around broad topics for data collection rather than communities. And this structure will help us make sure that the qualitative data we collect is relevant to a wider range of audiences. So it will allow us to dive deeper into the experiences of more communities, focusing on these kind of common or broad topic areas. So that's one change. The second is our scoping process. So for this round, we are collaborating with a wide range of state and local partners to identify the topics for qualitative data collection with a focus on what could help inform their work. So we hope this approach will help our team ensure that the data are as actionable as possible, and also to build relationships with partners that we can draw on and who we can collaborate with throughout the process, from planning to data collection to later dissemination.
Great, thank you, Emma. And Ben, would you like to share a key takeaway for engagement that is informing this cycle?
Yeah, sure. Well, I think one sort of major takeaway always is that that people know how to talk about the survey in the language that they have for it, in the ways that they know how to do it, and so that we can do all we can with developing communication materials and talking points and tips and all those sorts of things, which people do use and could use, but just the encouragement to like really sort of speak from your own space of knowledge, your own experience in why it is that you care about this survey in your own words. I think is that's what actually resonates with people, and that's what gets people to have some faith and trust that you as a champion, you as somebody who's asking somebody to participate in this survey, actually really feels it, and they're not just regurgitating something that the state has produced. And like in that spirit, though, one of the things that we are going to do a little bit differently this year, we like anecdotally heard lots of really cool things and interesting ideas and creative ideas of ways in which people were doing outreach and ways of doing engagement, ways of talking about the survey that was working. But we weren't really good at collecting all of that and then letting other folks have some visibility into those good best practices. So something that we're going to work on this year is really sort of see this as a big quality improvement activity in real time. So if some organization is talking about the survey in some particular way that's really resonating, we want other people to hear that so that they can maybe try it out if they want to in that same sort of way. And that the root cause listening exchange is probably going to be a really good place for us to be able to talk about that stuff and put those types of best practices and tips and all that sort of stuff in real time up into a space that people can access. So
that's very exciting. I know as one of the folks who will be helping out with engagement here in Western Mass, we're excited to hear that. Well, we're at the hour, so I think we'll need to wrap up. I know, McCain, you did reflect a lot on what you've been doing differently throughout your presentation. So I think we got that window into some of your takeaways. So what do we have coming up on the horizon? I'm not sure who is going to present this part, but I'm happy to if that's easiest. So our next webinar will be June 18th, and we will be able to at least start to share some of these great reports that are going to be made public soon. And then coming in 2027, there will be another data and action cohort. We'll be doing another round of these types of webinars. So please do go ahead and sign up if you're not already getting materials from the project so that you'll know what's on the horizon. And here are links to additional resources, and we'll send this out in the slides as well. And if you have a moment, please scan the QR code and fill out our survey. We'll probably also send out a survey feedback form. And thank you for the shout out in the chat. That's really high praise given that we all attend a lot of webinars. So thank you, Eva. And I hope you all have a great rest of your day. And thank you to our awesome panelists and to our awesome ASL interpreters.
Thanks, everyone. Take good care.